Hi everyone, this is going to be a video covering the topics of cataracts and cataract surgery. So before I begin discussing any information, I want to explain what exactly a cataract is. In your eye, there's a lens that's made up of both proteins and water. As you age, these proteins, these fibers, they begin to break down and clump together, forming something known as a protein clump. This protein clump causes people to see a sort of cloudiness or haziness in their eyesight. This is what you call a cataract. Although other than aging, one might also form cataracts in their eye through injury. The injury can be one that penetrates the eye, an electric shock, or a chemical burn. These types of injuries disrupt the lens fibers in your eye and cause eye cataracts to form either directly after the incident or months to years later. And as much as people like to try and just put on a pair of glasses to see better due to the haziness, this is not a way to fix someone's problem with cataracts. This is actually a way that you might realize you have cataracts growing in your eye. You put on a pair of glasses and your eyesight is still not as clear as you want it to be. It's not as clear as you always remember it being. When this happens, or when you can't see or read things you normally can, then that's when you know you should schedule a visit with an ophthalmologist to get your eyes checked. Now, it's good to know that you don't need to get these cataracts removed right when they begin to form. The decision on getting your cataracts removed surgically is fully based on whether or not the cataracts are constantly bothering you. Although, whether you decide to remove them sooner or later, they will not harm your eye. They will only continue to grow until you remove them at a later time. But if you do, one day, decide to get your cataracts removed, there are many lens options for you to choose from, each one with their own pros and cons. I want to start with the most standard option, blade surgery with a monofocal lens. So just to explain a little more, a monofocal lens is an IOL, an intraocular lens that gives you the ability to see either far or near without glasses. For this option, whatever distance you choose to be glasses free for, the other you will have to be dependent on your glasses. For example, if you decide that you want to be able to see in the distance, then for everything in your reading or near vision, you will need glasses to see clearly. Now for the standard blade surgery specifically, you won't get to choose a distance to see without glasses. For the standard blade surgery with the monofocal lens, you will just have the cataract removed and a monofocal lens put in. Even though you won't be able to choose a distance to see clearly without glasses, you may be able to see colors differently, such as dark corners that seem brighter than before, and colors in general just being more vibrant. With the blade surgery, you will still be wearing glasses after, as you always have been. However, there is another option where you can choose to have a monofocal lens through a laser-guided surgery instead of a standard blade one. This surgery will use a LenSx laser. And just to briefly explain for those who don't know, a LenSx laser is a type of advanced technology that uses a laser light to create all the necessary incisions during cataract surgery in a very accurate and precise manner. Now I want to go back to talking about the monofocal IOLs. So one of the biggest differences between the blade and laser-guided surgery with monofocals is that the laser-guided surgery offers the ability to reduce one's astigmatism, which is an irregular curvature of the eye, whereas the blade surgery doesn't. With the laser, you will also be able to have the option I mentioned before of choosing either distance or near vision to be glasses free from. Next, I want to talk about the toric lens. Now the toric lens, much like the monofocal one, allows you to have either near or distance vision glasses free and the other dependent on glasses. Now the difference between these two options is that, like I mentioned before, the laser-guided surgery with a monofocal lens can correct astigmatism. But when a person's astigmatism exceeds what the laser correction can fix, then the toric lens will need to be used instead of the monofocal. These toric lenses are offered in both the PanOptix and Vivity lens. And you may be wondering what exactly these two options are. Well, the Vivity lens, to start off with, is an IOL that allows you to see good in the distance and intermediate, but usually requires you to use glasses for near vision. Now with this lens, you will experience blurry zones. What that means is that whenever you're not looking at a specific focal point or a specific distance, your vision may be blurry. For example, if you're looking at a poster on the wall, you may have to lean in a little closer to see things clearly. For your next option, which is the last one I'm going to discuss in this video, it's going to be the PanOptix lens. Now this lens is going to be the one that makes you the least dependent on your glasses. You will be able to see far and near as well as intermediate glasses free. but this does not mean that you will never have to use them. With this IOL, you'll be glasses free for about 92% of daily activities, and for the other 8%, you may just have to reach for a pair of glasses or cheaters to see clearly. With all these lenses in mind, it is important to understand that there is no necessarily right or wrong answer in choosing a lens for your cataract surgery. The decision is solely based on your financial situation as well as how dependent or independent you have been from glasses your whole life. So, once you choose an option for your cataract surgery, it's time that you start preparing for that operation date. Before your surgery, you should avoid using contact lenses for at least a week before your operation date. On the day of your surgery, you should not wear any face makeup, cologne, or perfume. You should also not use any facial creams or lotion that morning. Lastly, before your operation, be sure to arrange plans to have someone drive you home after the surgery. After your surgery is performed, there aren't many limitations, just things like no heavy lifting, no leaning to where your head is below your waist, and no strenuous activities like biking or jump roping. Now, either months or years after your surgery, you may also feel like you have another sort of cloudiness or fogginess in your vision. This is found with about 50% of patients who get cataract surgery, no matter what type of lens they choose. You can get this removed through a quick surgery called a YAG laser capsulotomy, which is a quick and painless laser procedure done by an ophthalmologist. All in all, cataracts can come from aging or injury and may cause you to have difficulty seeing, but there are many different options to choose from when getting them removed, some even coming with extra benefits. If there was something I didn't cover, you can visit the Eye Center of Texas where you will learn more about your cataract surgery options. I've included their website as well as all of the sources I utilized in my caption. Thank you for tuning in to this video.